So welcome to our health activist interview series, Samara. Like, it's good to have you here, but maybe as a start, could you just please introduce yourself and tell us a little bit about what you do and your work and how you got here?
Sure. Thank you for having me here. It's a real honor. I'm a clinical social worker. I work at Brigham and Women's Hospital right now in the Department of Psychiatry, and I see a lot of patients with histories of trauma. And I also work on bringing trauma-informed care forward in the hospital systems to try to educate others and transform healthcare towards that philosophy or modality.
Well, let me start with the big question that we're going to have in this conversation that I believe many people grapple with across the country.
Yeah.
We're doing health activism and advocacy, how that can be also trauma informed.
Yeah.
The opportunities and dangers when we think about advocacy in this space for our patients and our communities.
Yeah.
Being trauma informed.
Okay. Oh, sorry, my cat's joining us. If you can hear. So I think I think it'd be good to explain the very basic tenets of trauma informed care just to start, because I think it sort of weaves into like the challenges and the benefits of how to bring that into health advocacy. But so there's 6 through SAMHSA. One is safety, the other is collaboration and mutuality, peer support, empowerment, voice and choice, and cultural, historic, and gender issues, and trustworthiness and transparency. And the guiding like philosophical question is to move from a sense of what's wrong with you, that sort of diagnostic question, to a much more open-ended question of what's happened to you. And it could be current or past, but that general sense of maybe there's histories here. There's layers of trauma to look at from my point of view and from others' point of view that is impacting the way people are showing up and thinking about their medical care, for example. So I guess I was thinking about like how we kind of help people think about health activism. And I was thinking about how that could be trauma informed. Was that your question? I think it was, or was it more the pros and cons of that?
No, exactly. Like how the activism and advocacy.
Yes. So I think it's like, there's an interesting, I know we were talking earlier, like there's that interesting overlap of using narrative to help people understand the impact of trauma, right? Like often, at least my patients that I've seen, talk about their traumas with me, but they talk about it only after there's layers of trust that have been built. So when we're talking about trauma-informed care, we often advocate for like a universal precaution approach. So maybe that would be something I think about, or I've thought about for health advocacy, is like the pros and the cons of bringing forward a trauma narrative to help people understand why, for example, trauma-informed care might be important, or flipping it and being like, perhaps this is something for us to think about from a universal precaution approach to understand, for example, that ACEs data, adverse childhood events, are really, really, really high in our population, higher than anyone would think. And that we could start to think maybe not so much as needing to sort of hear that proof of the trauma, but to start to think about it as our responsibility as providers to know that there's trauma in the room, whether we ask about it or not. So that's one layer. I guess another layer is thinking about how we can, it's sort of jumping ahead, I think, but how to think about the ways that things are done in our healthcare advocacy and how those might replicate the more structural trauma that a lot of patients face. So when they come to a healthcare provider visit, they're often thinking about the medical system in its entirety, not sometimes just us as the providers, right? Who is this? Do they match my identity? Are they going to understand me and my various identities? Will they make me feel safe, which should happen, right, with trauma-informed care? But then there's this whole layer that I think is really important to think about, which is the structural piece. So for example, a lot of medicine in general, large institutions of any kind are based on white supremacist culture. They're just sort of built into it. Like a lot of trainings talk about white supremacy cultures in the air we breathe. It's just there. So I think when we think about trauma-informed care, there's like a little bit of a danger to think, oh, that's something we do for our patients, right? That's something we should teach, and I have educate on. But then as I as I grew in my understanding, I was like, well, also we should understand that it's sort of like baked into our culture. And so those levels of trauma that are structural, that are sort of not talked about, are something that we should address, that we should be owning, to be like, there's a layer here of structural trauma that has nothing to do with our interpersonal relationship and everything to do with the structural layers that are built into our systems, so that trauma-informed care becomes also not about what's wrong with you and what's happened to you, but sort of like what's happened to us and what's the history here, which is why I really like that sixth, or it's not the sixth, but one of them, of the cultural, historic, and gender issues is one of those 6 tenets. I always want to highlight that. Let's kind of go back. Can we go back to that historical part again and really think about that? So for me, trauma-informed care is a lot about ownership and organizational change and thinking about what's going on here in the room and in our system, and also about who are these patients and what's happened to them. Does that make sense? Or does that answer the question?
No, that makes a lot of sense. And I love, especially if I may reflect, like, I hope that many activists who are hearing this would say, like, and remember this, like, what happened to us question. And I think
Oh, yeah.
it's a kind of like a powerful reframing of kind of like, where do we start? Instead of, first of all, like what you said, it's really not looking at things as problems, but thinking about, like, what is the history of that? Like, what led to this? But it also asks a deeper question of, like, what is structural and what are we contributing to? Like, it's not
Yes.
itself that it's doing, but it's us also that are part of that, both on the receiving end and potentially the change end. Like, I love that. What happened to us is a really, really powerful
Yeah. And
question.
there's like a sort of inside trauma-informed care movement of trauma-informed self-care, which I think is an interesting, when you say what happened to us, like, there's I think because of white supremacist culture in medicine and many institutions, but medicine maybe in particular, to be like, I'm okay, I'm fine, I can handle a lot, right? Because we have to. We're faced with trauma after trauma of, whatever's being brought forth often is quite traumatic. And we have to sort of lay ourselves away from that to seem like we're functioning. But I think what trauma-informed care and trauma-informed self-care asks of us is actually to keep asking that question: what happened to us? Do I have moral injury? Am I burned out? Are these systems that I'm functioning in hurting me as well as hurting the patients? Because there's like, I think there's a sense of, not only is in the air for our patients, but it's in the air for us too. Like when I train, we often talk about, don't forget, what's normal for you is not normal for the patient. So for example, we talk about like looking in your ear with the with the scope for the ear, like, to maybe many providers that's routine beyond routine, but for a patient it feels intrusive and very strange. And so I was sort of thinking about the same, like what's maybe become normal for us with moral injury, trauma, accepting white supremacist culture, for example, like individualism or extreme objectivity or paternalism, just as par de course. Trauma-informed care asks us to be like, that's not actually needed to be par de course. What it needs to be is empowering others and yourself, being trustworthy and transparent. And for me, most importantly, for activism, being collaborative and mutual. So I really like those. I love what trauma-informed care can offer in terms of real transformation. Sometimes I feel like, and I talk about it as the antidote to white supremacist culture, because it's so against, in a sense, individualism, but it just sort of wakes up that idea of, wait, we could be collaborative with each other, and our patients and the whole system could become collaborative. That would be transformational. So, I
That
don't
is,
know what do you think of that? Like, what does that bring you to?
I think it's really powerful. And I've seen, especially if you think about, like, in social movements and health activism, how people tend to forget, their own experiences, and really, because you're kind of like fighting for a cause, sometimes you forget that it's also like you're part of the equation here, and asking that question, for yourself is not a selfish question, but it can be actually that question that can help people build stronger relationship with each other in
Yeah,
this, and sustained, because the other part of that is, if we don't ask those questions, it's really hard to imagine that you can sustain over time.
yeah,
And that a lot, like people just burning out of their activism. So really asking those questions seems to be really fundamental in the way you can both experience and practice advocacy and activism. But I know are also an activist. Like, so like mean that as a, you know, like it's not, again, speaking of us, and you know, you have your own journey in that, especially fighting for trauma-informed care as a as a way to approach working with our patients and communities and our providers. So what inspired you to start and do
Mm.
that? What is the story, you know?
I think I was reflecting on it. I was like, I think the story is starting my work postgraduate school in homeless services, where right away, because I think of the structural system that causes homelessness in the first place in this country, I was just trained instantly, like every person you meet is traumatized. Doesn't really even matter. You know, it's already obvious because of the experience of homelessness. So for me, that was like my first introduction to like, right, that's how the structural impacts the individual, sort of, instead of just thinking of the individual. That's what it looks like day in and day out. And then when I moved into more of a medicine environment, it sort of became more of me wanting to push as an activist to be like, we can't, what I was saying before, we can't just keep looking at everyone as an individual. It's kind of a mistake. So when I think I read, I think it's Sean Ginwright, he wrote an article about the overlap of trauma-informed care and racial justice. And I think it was Rise that sort of coined a term, if it's not racially just, it's not trauma-informed. So as I grew as an activist, I was like, these have to be together. Like people have to understand that the individual, interpersonal, societal, historical, structural, like there's these layers and layers like an onion of trauma that if we try to just look at one, often individual or maybe the interpersonal, we really lose the ability to see what's happening on a structural level. And I think like the journey might be becoming a social worker and realizing that was my training, right? That was my thinking sort of bred into me by the social work school experience to really never look, as we call it, the socio-ecologic model, never to look at someone as just an individual, but to always see them in their environment. And for me, as I deepen my own understanding of racism, to see the impact of racism as underlying many, many systems, every system actually.
Yeah, can I ask you about that? I'm curious about the, you know, kind of like I've seen people, you know, this moment when we realize something and you kind of like you start seeing the world with
Yeah,
the, you know, and then you start seeing much more than you've seen before.
yeah,
There's a moment also when you start sharing with others that, like, you know, this excitement, like, oh my goodness, there's
yeah,
wrong and there's a way to for us to do it.
yeah.
How did people react, you know, around you? Because I know you've been for quite a long time in this space.
Yeah.
What were the reactions, like both good and bad, like in terms of kind of like, you know, if you think about it, like, you know, how people reacted to it, like, you know, to the idea of trauma-informed care, like in general.
Generally, on like a first look, I think people get nervous, providers, at least in the medical system, get nervous because everyone's overtaxed, overburdened, and now I think dealing with moral injury and burnout. So there's often a sense of please don't ask me to do one more thing, or I'm all for it. I have literally no time to do any more things. And also, I would guess there might be a sense of this is too kind of quote unquote soft, like this, there's no hard science or there's not enough teeth or where's the data. You know, it is more of a philosophy shift. So getting people to understand, I'm not asking you to train in an intervention. You don't need to be a psychotherapist. You don't have to know actually really much of anything about working deeply with people with trauma. You just need to know that trauma exists and is in the room. So I think once I can help people understand that they don't have to add on, it's more like, but they do have to shift and they have to become aware of their own power, the power in the room, the power in structures, what structures have done to people, and begin to allow themselves to alter their method of work, which is no small ask, but that's like I guess that's the activist, right? To be like, yeah, it's not really working the way it is. We're gonna have to look carefully and see what we can do different. But from experience, most people that have tried it on for size feel relieved. Like they're like, I didn't even know I could work this way. I didn't know I could bring in the structural layer, or it never occurred to me, but it makes so much sense to let go of the individual and bring in the structural, even into this appointment. I guess there's a compelling example. I remember working with someone who was being evicted, and I ended up doing on my own activism about it. But she's being evicted and felt suicidal because of it, because she'd internalized the individual, right, very deeply. And then when I was working there, I was trying to be like, you know, nothing about this has to do with you. It has to do with systems of gentrification and forces outside of you. But I used that explanation to try to advocate for housing outside of my job, to be like, this is what happens when you sort of change someone's environment to the point where they feel like they're at fault. So that would be an example of like just trying to use that trauma-informed shift for direct activism, to be like, people are getting traumatized by these policies and structures, and this is what it can end up looking like in the office, in a therapist's office, in a department of psychiatry.
Yeah, I really love. I think, you know, like, well, a couple of reflections on what you said. Like, one is the really think about it as a mindset shift rather than an add-on
Yeah,
to, and that resonates for on multiple levels. Like, especially in the context of kind of like activism as well. Is like one of the arguments that we're trying to make is that this is not an add-on to your existing work.
yeah,
Like, should be part of your work.
yeah,
And space for that to be kind of like, you know, like part of the identity, is where we see people, you know, benefit from it. And it's kind of like, you know, I really appreciated you saying kind of like how the mindset shift, it doesn't just benefit your patients, and communities, but it also kind of like has a positive impact on your own practice,
yeah.
and what impact that practice have, and how does that work. I think it's a really powerful thing. um so those were the positive reactions, but like, what about, I'm just,
Negative.
yeah,
Um,
it's hard for me to imagine that you haven't had.
I know, I feel like the pushback is mostly quiet, where it's like, you know, that's nice, but I don't have time to do it, so therefore I won't. Like, you can get trained in it, be excited or be mildly interested, but then there's sort of a sense of, I don't have time, so I'm not going to. I think when I first started to train on the overlap of racial justice and trauma-informed care, I think there was more pushback then, when people might have been like, I was coming for a training on trauma-informed care and not related to, you know, I think there sometimes can be that white sort of pushback of, I don't want to hear about racial injustice, or I don't want you to involve that into this training. I feel like you did a bait and switch. I can remember a little bit of that kind of pushback, because I think it is still can be new for people if they're really focused on patient care, to really kind of move out and be like, it's really, most things are a structural issue, and racism is a structural issue that needs to be talked about in trauma-informed care.
Yeah, it's kind of like, you know, when you think about trauma informed care, you do have to go to structural pretty fast, and structural is usually about shifting power. You know,
Yeah.
and
Yeah. And
it,
racial trauma is, you know, not as talked about as often as I think it needs to be, right? It's a little easier, I think, in some sense, for people, or at least white people, to talk about, oh, you know, adverse childhood experiences or sexual trauma or DV, you know, those are traumas that we're comfortable talking about. But when you move out into the impact of racism, racial trauma, other kinds of, you know, there's other isms, but that one just springs to mind, where there can be a sense of like, I didn't sign up to talk about that. So.
and you know, just for the, I'm curious about how do you make an argument like why that is the one to begin with in this country? Like, why
And this, yeah, well, let's see. Maybe you can help me with all the whys, but because this country is based on racial trauma, if I can understand, or at least some of my understanding, like the impact of slavery and the financial impact, the impact of colonialism, the impact of genocide for indigenous communities, like it's sort of woven into the beginning of the history of this country. And I don't feel like it's been, you know, really directly grappled with in what I would think of as a trauma-informed way. Like, there's no sort of naming it as forward in our society as, this is a trauma, this needs to be, you know, there needs to be like truth and reconciliation, there needs to be justice, and, you know, sort of, I think about what's maybe happened in South Africa to good or bad effect, that beginning push of like, we need to name this as the trauma that it is. Is that what you're getting at? Or maybe I'm not sure if that's quite.
that is a really interesting thing, because like what I was, you know, what I was curious about is the, you know, what you were describing in kind of like when you introduce that, and reactions that you will get from your white colleagues, because like even on this call, like they're like two of us are white, and then like, but I always, my argument is that it is part of our responsibility to some extent to raise that, to raise that question within our own constituency. So
Yeah.
how, what's your experience with that? Like, really, and how do you think about it in the context of your own role, and advocacy and activism? Like, among.
I mean, I don't think I've had an audience when I have trained on trauma-informed care and bringing it forward. I don't think I've ever had a just white audience, so I often feel like I'm trying to talk to many people at once, but bring forward these issues as openly as I can, or as similarly as we're doing now. So I don't know. I don't actually know how to answer that, honestly.
It's fair. Like we can.
Yeah.
One last question that I have is, and I ask like most of the people we talked about, like what gives you hope? Like where do you find a source of kind of like hope that this work matters and that it actually is worth staying work, despite the fact that the change is slow sometimes and it feels like it's you go one step forward and then 2 steps back and all of that sometimes. So what gives you hope?
That's a good question. I think the depth that trauma-informed care offers gives me hope. Like now that I've internalized it, I feel like you can't stop seeing things that way. Like it's relevant in so many situations. And for me, it's sort of like the trustworthiness and transparency. I think empowerment, voice, and choices are already, present for anyone who's interested in activism and is peer support and cultural, historic, gender, and other issues. But those two, this collaboration and trustworthiness and building of trust, to me, like I come back to those again and again, and I guess it gives me hope because it's so connective. It's so like when I listen and learn and try to think really deeply on like what's not white supremacist culture, and I feel like what's not is those things, is collaboration, is trustworthiness, and building trust and not rushing and being able to sort of let go of that I have deeply internalized, like everything's about individual and status and power, and I've been trained to just think that way whether I want to or not. So I find hope in thinking about letting that go and really feeling into what would it be like to really, really collaborate and be very mutual. And then I feel better because I'm like, I think that's, to me, I feel so much hope because like that, I think is the answer. Like that's how we're going to survive and heal and grow. So I try to bring that energy forward just as much as I can.
I love that answer, especially like, how connections and relationships can help us heal and grow. And yeah, thank you so much for this conversation. It's been fascinating, and as I said, like I think such a relevant topic because both for activism in the broader context, but also like activism for trauma-informed care as a way of creating that mindset shift and healing for both healthcare providers, but also their communities that they're part of. So yeah, thanks for this conversation.
Thank you. It's been a joy.